what was your like light bulb moment or your like thought process when you discovered that this is the area that I want like specialize on, or this is where I'm most interested in?
I would say that would have been like, I'm not exactly sure on the year, but that
Yeah.
was around maybe 3 to 4 years into orthopedic.
Mm-hmm.
I was, actually an excellent question, no? Because I, just like anybody, I really got burned out.
Mm-hmm.
Okay, it's like I really kind of didn't want to go to work. It's like I was burned out. So but
Mm-hmm.
then I left the company, and it was very easy anyway to find jobs back then. And so I, kind of like touch a little bit on home health, skilled nursing, acute care. So like I wanted to try all of them.
Mm-hmm.
And after 6 months, that's when I realized, I'm like, okay, I'm not really happy here, no?
Uh-huh.
So I really miss my patient. I miss, like, my, because a lot of orthopedic patients, they're in a lot of pain. They have functional limitation, but you can really communicate with them, and you really could really get into, like, the tiny little details of, like, their problem. So, and
Mm-hmm.
I miss that. So actually, after 6 months, I came back, and that is actually when my whole career changed. Because when I came back, I and I exactly know it's 6 months. I just cannot remember the year, because that was when my previous boss, actually, Lenny Olfindo. So she she called me, and so she was like, "So are you ready to come back?" I'm like, "Okay." So apparently she did not fully terminate my paperwork. No, like,
Oh, okay.
I was not fully. I know that was like really very interesting. So I wasn't fully terminated. So then I really was able to get my tenure and all that. Like,
Mm-hmm.
so, but when I came back, that was the time that I really spent a lot of time. Like, okay, this is something that I really love. So I really need to do something. Okay, like progress myself, promote myself. Because again, in the beginning, I was just going through the routine, doing my hot pack, the tens, and the ultrasound and exercises. No,
Right.
so patients are getting better. They will get better from these things. But then I'm kind of like, there has to be something that I could do to make them better sooner.
Mm-hmm.
Okay, sooner, faster. And I got to meet like a lot of interesting people through the years. So then I'm like, you know what, I'm gonna start doing like all this manual therapy stuff. So I started attending a lot of different courses, like mobilization, uh exercise prescriptions, strain counter strain, even did craniosacral therapy. No, so I
Mm-hmm.
did a lot of those things. No, so then I'm like, okay. So then I kind of got a little bit and bits and pieces of like the various techniques, and I got to develop my own.
Mm-hmm.
Because like again, just like what I said in the beginning, each technique have their own little kind of perks.
Mm-hmm.
So I really, for me as a manual therapist, I would not really say that I am just a manipulation therapist. I don't
Mm-hmm.
just do manipulation. So
Mm-hmm.
I might even have a patient that I might just do soft tissue mobilization.
Mm-hmm.
I might have a patient I might just do some, let's say, muscle energy technique. So things like that. So it would be dependent upon what I would kind of think would benefit the patient.